Hi, this is Jessica DeMassa, and I'm here with Jerry Shultz. He is the president of LightBeam Health Solutions. Jerry, tell us a little bit about LightBeam.
So LightBeam develops solutions that allow provider organizations or risk-bearing entities to take more risk. We think the market is ready to explode if they had the right technology, the right end-to-end solutions that would help them scale their at-risk contracts. A number of companies have tried, but they've cobbled together solutions that haven't quite hit the mark. LightBeam has invested about $25 million in a solution that truly is end-to-end from data acquisition through action. So we aggregate data and then we provide it back to the doctor in an actionable way. And we're delivering real results. Our customers have now realized about $300 million in savings in shared savings contracts. Mm-hmm. We are saving lives. We are identifying women that had breast cancer, that stage 2 that had previously been undetected, and we're reducing cost.
Okay, I want to go back to what you said about healthcare organizations taking on more risk.
Mm-hmm.
From a real high level, why is that important?
So I think one of the speakers here this morning, and I already saw it printed on the blog, said that the cost of healthcare is unsustainable. For years, physicians have been paid for volume and paid for performing procedures. That is unsustainable. Healthcare has to shift to value. The cost curve is unsustainable. So what's happening is that risk is being pushed down to the doctors, who are now being incented to keep patients healthy and keep them out of the hospitals and keep them out of the emergency room and do good for the country and try to drive the country's healthcare costs down as well.
As far as like these tech solutions that are being thrown at this, it feels like the marketplace is getting more and more fragmented. Mm-hmm. Are these end-to-end solutions that are supposed to be helping manage risk or manage populations better, are these becoming like the new EMR where everything is so siloed that we're going to end up in a tricky situation to get out of?
That's a really good question. What we see when we engage a partner is they have 20 or 30 different systems that manage some pieces of the data already. A patient's record is in their EHR, it's in the lab system, it's a hospital system, and what systems like ours are trying to do is try to unravel that, create a complete single patient view of that entire patient's health, and then identify care gaps or where they are at risk. Everybody has an aunt or uncle who doesn't take good care of themselves, who's diabetic, hasn't had a foot exam in 2 years, mm-hmm. who may have problems that could be really serious and lead to things like amputations. So we're trying to aggregate data from all over, run it through the best evidence-based care guidelines, identify gaps in that person's care, and then make sure they get to a doctor to receive treatment.
Yeah, but big picture, I mean, thinking about these different disparate solutions, 20 different companies that have solutions plugged into different parts of the health data ecosystem. It's like, is that sustainable for healthcare moving forward? What do you think?
It's not, but there's so much invested in those systems that they're not going to be able to unwire them for many, many years to come. Solutions have to come sooner than that. So what we try to do is we try to reach into each one of those systems and pull out the meaningful information, identify information that allows us to find a patient who is at risk, a person who should be treated for something. And that therefore allowing them to not invest in technology that just replaces. The other problem is, if you look at a large health system, mm-hmm. they might have a large single system like Epic or Cerner at the center of it, but they have thousands of small EMRs that all have silos of data. So what we try to do is we reach into all the systems, we aggregate it, we can create that single place to look at the data, and then we send it back to them in their workflow. They would have to spend hundreds of millions of dollars to get everybody on a single platform, and that would literally take years and years and years.
Is that not better, though, in the long run?
I don't think so, because you're driving. You're still having to address the core issue, which is what in that data. People with Epic, for example, already have lots of data. And are there the kinds of things that they're doing with that data to drive down cost of healthcare and drive up quality? Mm-hmm. I don't think they are in many cases. And that's not a knock on Epic.
No,
it's a great system.
It's what it's built for.
So what we're doing, we have tools that automate the workflow around patient conditions and then drive it back into the Epic system or back into their native system. And we think that's the missing piece, are things that create actions from the data and then pushes it back to them.
Okay. Last question for you. So we've been asking everybody, we've been asking everybody about their WTF health moment. Okay, and so what that means is not what you think it means. It means, what's the future? Like, where are we going? So WTF, what's the future? So where is this going? I mean, like we've seen a rise of solutions like yours. I mean, there's a lot of different ones, especially at a place like HIMSS. There's a lot of different solutions. So what's the future? I mean, are we going to start seeing some consolidation? Are we going to start seeing things be replaced? I mean, we're seeing big tech companies come in like Apple, Amazon, Google. I mean, what do you think is next for this space, if you had to predict?
A couple different things. Artificial intelligence, the emergence of artificial intelligence. We're now using AI to surveil patient data, identify patient care gaps, identify patients who probably are diabetic but don't know they are, walking around with diabetes. We think integrating entire genomic databases into ours to, again, create a complete single picture of that patient's health and then acting on that data. I think in 2 or 3 or 4 years, if a doctor used to see 40 or 50 patients a day, that's what he or she was responsible for. Now that doctor in an at-risk model is responsible for 1,000, 2,000 patients. So how do they manage 2,000 patients? It's going to require automation. Automation has to be part of the solution. So you're going to need systems like ours that surveil those patients daily and identify at-risk. So we're really looking at this like, how do you automate care management functions so allow care managers to manage 2, 3, 4 times the number of patients they currently manage?
Great. Well, we look forward to seeing that future unfold. Thank you so much for joining us. It was a pleasure to speak with you. I'm Jessica DeMassa. Thanks.